Good afternoon, all of you. And as you can see, I'm parked on the road. I'm gonna take off my glares. I'm parked on the road, but that's because I'm committed to making that video about vitamin D. I'm actually going to my aunt's house. Um, she's not feeling very well, so I'm, just going to check on her. But let's talk about vitamin D. Now, why is vitamin D important? No, let's start with the basics. What is vitamin D? So you may be hearing this word vitamin many times. Vitamin. Now, basically, it's a shortened form of vital amines. Vital meaning something that's important for the normal, functioning of your body, and amine is that they are amines. Now, so by going by this definition of vitamins, vitamin D isn't exactly an amine, but it is vital for your body. I mean, that's just something technical, you don't need to worry about it. Now, number two, what are the major sources of vitamin D? Well, we cannot synthesize it or make it in our body. We cannot produce it in our body, so we need to get it from outside. There are two primary sources. As you can see, I don't know if you can see or not, but the sun. And number two is food. So number one source of vitamin D is the sun, and number two is the food. Now, sun. From the sun, two factors will influence how much you end up absorbing. One is the color of your skin. So if you're somebody who's really fair, you'll be absorbing a lot more vitamin D from the sun, and very quickly, and which is like a double-edged sword, because then you will be more prone, sadly these people are more prone to skin cancers and also skin aging. So sunlight is directly responsible for skin aging. So much for night cream, day cream, this serum, that serum, and so much for all the skincare routine that we follow. Sun is the number one defaulter, the number one guy to blame for bad, for quickly aging our skin. So yes, in studies it was found out that fair people absorb sun rays very quickly, which obviously makes that they need to expose themselves to the sunlight for shorter durations, and they need to be very careful because they will also be more prone to sun cancers and skin aging. Similarly, Asians, Indians, us with brown skin, we are known to absorb the least sunlight, which means we are prone to vitamin D deficiency, and we need to be careful, which is why you need to listen to this video carefully and pass it on to your friends and family and loved ones and your bosses, so they allow you to go out of office often. See? So vitamin D cannot be made by our bodies. That is why we need it from outside. We can get it from the sun, which will depend on our skin color and the region where we are. So certain regions on Earth receive more UV rays, more sunlight. Certain regions don't. So depending on those regions, also the absorption will vary. Now, food. There are three known highest sources of food for vitamin D. Number one being fatty, oily fish, like salmon, mackerel, tuna. Number two being livers. Number three being egg yolk. Yes, so it's fatty oily fish, it's livers, and it's egg yolk. Not just egg white, it's egg yolk. And of course then there's fortified milk, and then there's fortified cereals for vegetarians. So those are your food sources. Now, what happens when vitamin D is less in our body? Or what does vitamin D do? Let's first look at that. So now you've gotten your vitamin D from the sun, which is D2 version. You've got your vitamin D from the food, which is D3 version, and it's in your system. Now from your system, it goes to the liver, which is where it is stored. Correct? And something called the 25-OHD. Now this is your circulating vitamin D. This is what I will ask for or check when I order a vitamin D blood test for you. 25-OHD. This is the circulating vitamin D. So it's in your system, now it's in your liver. Now it is still inactive. It is not active. It is not getting absorbed by your body. To activate it and to make it more potent, it is sent to our kidneys. Our kidneys have something called vitamin D receptors. So your vitamin D has come, your kidney is waiting there with these receptors. Your vitamin D will bind with these receptors, and it has an amazing quality. It's able to enter the membrane of our cells and actually reach the nucleus of our cells, impacting the entire functioning and behavior of the cell. Now hear this very, very carefully. Vitamin D is a fat-soluble vitamin, which gives it two beautiful qualities. One, all our cells have these boundaries called membranes, like these homes, and they have picket fences around it, like a defensive boundary. Our cells also have these membranes around it. Vitamin D, being fat soluble, is able to go to our membrane and actually kind of become soluble there and seep through and enter the cell. Now once it's entered the cell, it has the ability of influencing the nucleus of the cell, which is the thinking part of the cell, the part of the cell which makes all the decision making. So yes, vitamin D influences you at a cellular level. Number two, because it's fat soluble, it can be stored as fat. So you can be exposing yourself to sunbathing, sunbaking during summer months, and then in the winters, that stored vitamin D will be used by your body. Those are the two good things about vitamin D being fat soluble. So now you've understood what is vitamin D, how it enters our body. It's inactive till the liver, then the kidney activates it. Now what does it do? So vitamin D, as most of us know, is essential for bone health. You may be ingesting tons and tons and tons of calcium. If you do not have vitamin D, that calcium will not get absorbed in your bones. So number one function is absorption of calcium, magnesium and phosphorus. That's what your vitamin D does. Number two, it does something really interesting. Oh my God, like our body is just, it's yummy. So what it does is it chisels away all the bad bone cells and all the dying bone, so that new bone cells can regenerate. That's another thing that vitamin D does for your bones. Number two, it is now known that it influences our immune system also. And how? I'll just tell you in a minute. Number three, the thing that we spoke about yesterday, how it impacts our sexual health. It very much impacts our sexual health. So there was a study done with 3,000 men in it. The study was done with 3,000 men in it, where they observed that they were having not hard enough soft erections, which were obviously impacting both the quality and duration of the intercourse. So normally people would have just straight away put them on Viagra's and Cialis, etc., which is like the first line of treatment for erectile dysfunction. But in this case, they checked that almost all the men had deficient vitamin D. Their vitamin D was less than 20 nanograms per milliliter. Less than 20 nanograms per milliliter. And these men were given then vitamin D, I think about 4,000 international units for 2 weeks, and then some 2,000 international units beyond that. Don't copy me and start taking this on your own though. I'm warning you here. I am suggesting you don't do that on your own. But yes, so it was found out that their erectile dysfunction or the fact that they were not achieving hard enough erections for intercourse had some sort of an association with vitamin D. Now, does this mean that you tomorrow start having 10 kilos of vitamin D every day and you'll have an erection that will last you a year? Sadly, no. So there is a difference in causation and there is a difference in correlation. And this was a relation in the study, which definitely goes to show that vitamin D is important for our sexual health, right? It also tends to lower the sex hormone in men, which is called testosterone. In women, it may cause fatigue, listlessness, and most importantly, it will mess up their ovulation. It will impact them in their IVF procedures. There'll be more chances of failures. And sometimes it's also kind of has a role to play in PCOD, which is polycystic ovaries, which then impacts your fertility in women. So yes, in both women and men, vitamin D seems to play a role in our sexual function. Thus, it's important. We sing "Meri Jaan Murgi Ke Ande," or you have fortified milk, or then you have the supplements available. So, one was bone health, two is sexual health, three is immunity. Now, in recent studies, they found out that those receptors which I talked about, which are present on our kidneys, which are able to bind with this vitamin D, are also present in our myeloid and lymphoid systems, which are essentially our immunity building systems. What is immunity? It's the ability of our body to fight disease. So every time bad bacteria, fungus, COVID-19, all of these viruses, ailments enter our body and attack our body goes into a fight mode. Our body's defense system goes up. So immunity building systems are your defense systems essentially. They're your Indian armies, if you may look at it like that. So now these cells, the white blood cells, which are your immunity building cells, also seem to have these vitamin D receptors. So vitamin D now is able to enter the cell, the nucleus of the immunity building cells also, thus influencing our ability to defend. It's empowering your body's army, right? So that's the third important role. Now what happens if it's deficient? When it's deficient in children, a disease called rickets happens, which means soft spongy bones, which then leads to painful existence and frequent chances of fractures. Now what will happen if I fracture a solid? It will crack into 2 or 3 pieces. The chances of joining it together and healing it are higher. What will happen if I powder or if I fracture a powdery chalk? Those particles will just spread. How the hell will I make it go back to its original space? So spongy bones, brittle bones are really dangerous for that reason. In adults, the same disease is called osteomalacia. Osteo means bone, malacia means soft bones. My hand is tired. Let me hold it in the other hand. Osteo means bones, and malacia is see, it got all red. What all I go through for you guys. In adults it's called osteomalacia. So rickets in children, osteomalacia in adults. And of course, like I said, it helps with your sexual function, it helps with your immunity building. There was another study. Now this is very important. Please hear this very, very carefully, especially if you have old parents, grandparents, family friends who are in their 60s and above. This is a very important information. There was a study done in which men of the ages of 70 to 80 were picked up, and this study went on for 15 long years. And after 15 years, data was revisited and the cause of their death checked. And before 15 years, their vitamin D levels were recorded and kept, and after 15 years then they went back for a follow-up study. They found out that of all the deaths that had happened, 41% people who passed away were with respiratory disorders, and they all had vitamin D deficiency. So definitely respiratory health gets impacted with the levels of vitamin D, which is why it is apparently helping with the COVID treatment. See, there's a relation. You have to understand. Vitamin D is able to go into our immunity, our defense systems, empower our body's army. Then it's able to help with respiratory health, and now it's being used in COVID treatment. Right? It's also advised for COVID patients who have healed to continue having vitamin D for a certain duration. So it's all, it's all making sense now. Start understanding these things so that it becomes easy for you. So yes, bone health, immunity, respiratory diseases, sexual health is what I covered. Now, what is like the normal, prescribed units of vitamin D for an healthy adult? It's 600 international units per day. 600 international units per day, but mostly you get these soft gels which are for 1000 international units per day. So there are 3 ways, other than your food and the sun, if you're deficient, there are 3 ways to get yourself vitamin D. One is your nanoparticles, which are your sachets, which you take once a week for 8 weeks. Other is your soft gels, which you take daily. And the third thing is your shots, your injections, which you take as a one-time thing. Now that you're like, oh my God, I'll have better erections, my immunity will go up. It might also make my body stronger to fight COVID. Let's just load up on vitamin D. Please don't do that. I always advise, my patients, number 1, do not start on a supplement till you need it. So get a blood test done. Check out if you actually are deficient in vitamin D. For Indians, if it's less than 20 nanograms per milliliter, that means you are deficient. If it's between 20 to 30, it's insufficient. So you need to first check if you're deficient and insufficient, and if it's deficient or if it's insufficient, and then start on a vitamin D regime. Now, suppose after 8 weeks, 10 weeks, 6, 12 weeks, your vitamin D level reaches a normal. Then I would advise and humbly suggest that you shift to natural sources of it. Start going out and playing in the sun. Start walking your dog in the sun. Start having fortified milk, or have egg yolk, or have fatty fish, or have cod liver capsules which you were given as children, because cod liver has the maximum concentration of vitamin D in it. So you can have cod liver oil capsules. so on and so forth. So our body recognizes natural sources more than synthetic sources. So I always tell people, once your deficiency is corrected, don't continue to bombard your system with these synthetic, with pills and gels and this and that. Please go back to your natural source, which is your sunlight and which is your food. If you remember, in winters in North India earlier, grannies and aunties and everybody would be knitting in the sun on a bench. Some 10-15 ladies would be pickling, they would be weaving, and their grandchildren would be playing. They had natural wisdom. They knew that sunlight hours are less in winters. They need vitamin D. They obviously knew it's important for their health. So they incorporated these routines on a daily basis. Men would be reading their newspapers out in the sun. Some 2-3 uncles would be seen, talking about local politics and who's an MLA and what the hell is the government up to. So all of this used to happen out in the sunlight because they knew how to get that natural source in. We have divorced that granny's wisdom, and is why you're hearing me today. Yeah. Now, some of us tend to think that you can be inside a car and be parked in the sun, or, be in this glass room or gazebo, or your office window is letting the sun in. Knock, 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 wake up. Only UVA passes through glass, which is actually responsible for giving us skin cancers and aging our skin. UVB doesn't pass through glass. So sitting inside a car or in a glass room is not going to serve your purpose of exposing yourself to sun for the reason of absorbing vitamin D in your system. Is there anything that I have left? I don't think so. So I hope, I'm parked on the road. I need to get to my aunt, but I had promised you guys that I'll let you know more about vitamin D. One, do not rush to your chemist. Do not buy things from chemists. I always say so. But discuss this with your doctor. 2, start getting natural sources in. Push your children out. In fact, go out and play with them. I'm just going to be playing a game of badminton with my niece after I check on my aunt. Not in the sun today, but go out, get your sun, and let your body process it naturally. Oh, one more thing. There is one known thing which stops this vitamin D from going from inactive to active. Remember, I told you it gets activated by the kidneys and is made 100 times more potent in our kidneys. So this 25 OHD, when it goes to our kidneys, it's turned into 125 OHD. Its potency is increased by 100 times in our kidneys. So now this thing where the inactive vitamin D is now becoming active vitamin D can be blocked. There's a speed breaker there, which is your high fructose corn syrup. I have written about this before, those of you who follow me. High fructose corn syrup. Now, please check your labels. You may be, sitting in the sun for hours. You may be eating your egg yolk and your liver and your soft gels and your sachets, and still your body will not be using that vitamin D because you are just going on yumming up that jam and those chocolate bars and those syrups to spread over your toes. In the name of health, sometimes they don't just write sugar, so brands have become very bright. They write something called high fructose corn syrup or corn syrup. So be very, very careful. This corn syrup, this fructose syrup, actually stops the conversion of your vitamin D from an inactive to an active form, rendering it almost useless. Yes, that was something I had to keep in mind. All right then, people, I will see you tomorrow with something more interesting and new. Till then, don't follow me, make your own decisions, be more informed though. Here's to the power of knowledge. Bye-bye.